today we're going to continue the topic on diabetes, but today I want to talk about diabetic kidney disease or diabetic nephropathy. When the patient has uncontrolled diabetes due to that uncontrolled glucose, the kidneys will eventually be damaged. Um, Coming over here, let's talk about metabolic syndrome. Metabolic syndrome basically means when you have risk factors that increase your risk for hypertension, heart disease, or type 2 diabetes. The reason why I say this is because uncontrolled diabetes or uncontrolled hypertension is the highest risk factor or the number one cause for kidney damage, guys. And the reason why is because I want you guys to think about that analogy with that hose. If there is a hose that has excessively high pressure, what's going to happen to the inside of the hose? It's going to get damaged, right? Likewise, guys, when a patient has uncontrolled diabetes, well, that glucose is just hanging out in the blood vessels, not going into the cell where it's supposed to again, and that'll cause your osmolarity to increase. Going back to that hose analogy, if the hose is running with pure water, it's going to run nice and smooth. But if it starts running with mud and dirt, it's going to start clogging. It's going to get thick and it's going to become syrupy. Exactly the same thing with excessively high glucose. Guys, glomeruli are these tiny blood vessels in the kidneys that remove waste. So, if the blood vessels, if these tiny blood vessels that are super delicate either start having this bounding high blood pressure or this syrup thick like consistency of blood, it'll start really damaging them, start damaging the walls of them and start clogging them due to that high blood pressure or that syrup like consistency with blood, causing the glomeruli to start failing. This will lead to something called micro or macroalbuminuria. It's really simple, so let's break it down. Micro is meaning small, right? Albumin is a protein. Urea present in the urine. A small amount of albumin present in the urine, about 30 to 300 milligrams per day. Macro, large amounts of albumin present in the urine, greater than 300 milligrams per day. Guys, if a diabetic patient presents to the clinic, they pee in a cup, and then we analyze it and we see that there is protein in the urine, especially if they are a diabetic or they have uncontrolled hypertension, then we can already tell that the patient's kidneys are already starting to fail because normal kidneys should never leak protein into the urine. Another test that we can use to be able to tell how well the kidneys are doing is something called GFR or glomerular filtration rate. So the glomeruli, guys, they filter, and we can tell how well they are filtering through these stages. Stage 1 meaning it's perfectly healthy. Stage 5 meaning the patient has end-stage renal disease. There is no saving that kidney. So guys, if a diabetic patient comes in and they are going down this stage, these stages, our goal